Hello everyone, my name is Pearl Chavez Arca. I'm a previous certified dental assistant and office manager. I have been in the dental field for more than 20 years. Did you know that for dental professionals in the U.S., we have a minimum of 4 organizations that ensure your safety as a patient, namely JCAHO, OSHA, CDC, and ADA. These are nonprofit organizations that your dental provider must be compliant to keep their accreditations. I plan to inform you how you can help the dental professionals protect yourself from any spread of disease in a dental environment. Today in healthcare, we are more educated in how important it is to sterilize. There is a high threat to patient health and to the healthcare workers if they are non-compliant. According to the Joint Commission, an independent nonprofit organization and accrediting body in the healthcare, they claim that in the year 2016, 53% of the office-based surgery settings had non-compliant findings associated with breaches and high-level disinfection in the sterilization processes. This is why it's so important to make sure we are familiar with the basics when being treated in a surgery setting. First, I intend to go over some steps to ensure there is good infection control in your dental office. Second, I intend to give a short explanation of why it's so important. So let's begin with the important process of good infection control. This all begins in the dental operatory. According to Tom Draper, DMD, a dentist in Virginia, in the article How to Tell If Your Dentist Has a Good Infection Control Program. This was published back in 2010 on the website called Oral Enhancers. As you walk in, make sure you notice if there are clean dental barriers. These are protectors such as light handle covers, pinnacle sleeves that cover handpieces and water dispensers, chair covers. Make sure they have washed their hands, dried them, put on their gloves. They should be wearing disposable gowns, face masks, protective eyewear. Most of all, make sure when they have your instruments, they open the sterilization bag in front of you. They should have an indicating tape with the color turning either dark brown or black. If it is pink, those instruments are not sterile. According to OSHA, in the OSHA fact sheet published in 2011 in January, carefully handling of contaminated sharps can prevent injury and reduce risks of infection. This is just another way to ensure that there's no contamination to you or the doctor. Contaminated sharps should be using puncture-resistant caps. Second, the importance of sterile environment, it is so simple. Just basically, you don't want a transfer of any disease. According to the Health Department, to the Centers of Disease, JADA, the Journal of the American Dental Association, Dr. William Kahn found literature from 2003 to all the way to 2015 reporting transmission of bloodborne pathogens in a dental setting. This was due to lapses of prevention efforts. Infections submitted by state health departments to the Center of Disease Control and Prevention. So first, I spoke to the process of sterilization. Second, I explained the importance of understanding the sterilization process. By knowing your health is cared for properly and the use of proper infection control by your dental office, this will put your mind at ease when you're being treated. So in conclusion, by explaining the risks that come when we are in a dental surgery, we can avoid any contamination by simply paying attention to our surroundings. Thank you.